Okay, so the case study that I decided to do my project on is found in the American Journal of Health Behavior, and it has to do with social marketing and health problems and how they feel that marketing can help improve people's health, basically. Specifically breastfeeding and the National WIC program. So the theory is that social marketing can improve breastfeeding among women who participate in the WIC program. Social marketing began around 1971 when social activists believed that they could change society using marketing strategies. Since it was founded and accepted, it has been used to help certain health problems such as drug addiction or drug prevention, domestic violence, child abuse, and now breastfeeding. The WIC program was established in 1972 in hopes to support disadvantaged women with infants and young children by providing them nutritional education, nutritious foods, and referrals to certain health problems that they may have needed. Although they are provided all these resources, the breastfeeding rates are actually lower than those in more affluent communities. Due to that, a nonprofit social marketing organization proposed a project to help support the National WIC breastfeeding promotion project. They predicted that by promoting breastfeeding among these families enrolled in WIC or even those eligible for the program, that they would increase the breastfeeding rates. The study used 10 states to serve as research sites for the project, and their first step was to identify first what the population of the program was, as far as how they identified themselves, and then they had to identify their perceptions of breastfeeding and bottle feeding, the factors that influence their feeding decisions. Also, a big part of the project was actually the WIC employees and the WIC participants, husbands and boyfriends, views on breastfeeding, because breastfeeding, there's many social norms that go along with that, as far as breastfeeding in public, breastfeeding uncovered, and stuff like that. They also had to identify which factors would promote these women into breastfeeding and encourage them to breastfeed in order to be successful. The project relied on both quantitative and qualitative data. They used observation in 5 pilot states. They did many in-depth interviews with the participants as well as employees. They also did group interviews with participants and healthcare providers, as well as telephone interviews and surveys. They collected the data over the course of a whole year, and that was the quantitative part. The qualitative part was where they explored further, and they did a 53-item survey instrument to 292 participants in 12 different clinics. They represented urban, suburban, and rural communities. Small, medium, and large caseloads were selected. Different populations were participated in the survey. Less than 5% of the participants refused to participate. As a result of the different surveys, the interviews, the phone calls, all of the research methods, they found that mothers liked the benefits of breastfeeding as far as it prevents illness. It creates a really close bond between them and their child, and gives them more time together. But they did not like some of the things that they would have to sacrifice, such as they thought there would be some embarrassing moments in public, that they would receive criticism from friends or relatives. They're also worried about the more time that it takes and how it can cause conflict with work schedules or school schedules, and even their social life. Some also worried that their boyfriends or husbands, mothers, and other close relatives would feel left out of the feeding process and would not be able to bond with the baby as well. Also, of course, there's pain involved with some women.